No.
Okay, so we've already checked our medications with the MAR and done the 6 rights, make sure I'm giving the right medication to the right patient. So we're going to start off with PPD, which is our intradermal TB skin test. So some side effects that are associated with this could be like itching, swelling, redness, pain at the injection site, some inflammation or allergic reaction. So just let your patient know that any of those things could happen. And then have them let you know. So you want to make sure that you're using like about a 25 gauge needle, pretty small for the intradermal. So we're going to go ahead and do that. I'm going to go in, I would clean it with the alcohol swab. I'm going to go in with the bevel up at a 15-degree angle, just right underneath the skin, and then I would hold it steady with one hand, go ahead and inject the medication, and make sure I have a nice bleb on the skin. And then I would have them closely monitor it, discard my needle, and then have them come back for that. Our next one is going to be our subQ medication. So we have our insulin. Your subQ locations can be the fatty part of your arm or your stomach. For subQ, you want to pinch the skin. You do not aspirate. Some side effects of insulin could just be like hypoglycemia, allergic reaction, things like that. So you just want to make sure your patient's aware of that. So we're going to go ahead and go in at a 45 to 90-degree angle. We're going to pinch the skin. Oh, I would have cleaned it with the alcohol swab too. And then go ahead and inject the medication. And there you go. Okay, the last one is we have our Novolog pen, which is also subQ. Our patient is supposed to get 8 units. So I'm going to go ahead. I'm going to clean the end of the pen. And let that dry. Go ahead and put the needle on. Just screw it on. Okay, I'm going to prime it with 1 unit to make sure that that there's no air in the needle. I'm going to go ahead and set my pen to 8 units. Clean the site with an alcohol pad. Wait for it to dry. And then squeeze it. Go in at a 45 to 90-degree angle and inject the medication. Thank you.